New at 5, we are getting answers about the controversial drug hydroxychloroquine. Now, studies suggest it is not an effective treatment for the coronavirus, but President Donald Trump is taking it anyway as a preventive measure.
What do you have to lose? Okay, what do you have to lose?
So I
have been taking it for about a week and a half.
Channel 11's Melanie Gillespie spoke with the director of the Pittsburgh Poison Center about the drug and its side effects.
Well, doctors say taking any medication without good evidence to back it up can be dangerous. But what is hydroxychloroquine and what are the implications of taking it? We went straight to UPMC doctors to find out. Hydroxychloroquine, a drug typically used to treat malaria, is back in the limelight after President Trump told reporters yesterday he's been taking it daily as a preventative measure, despite not showing any symptoms of COVID-19.
Did the White House doctor recommend that you take that? Is that why you're taking it?
Yeah, White House doctor. I didn't recommend. No, I asked him, what do you think? He said, well, if you'd like it. I said, yeah, I'd like it. I'd like to take it. A lot of people are taking it. But you look at frontline workers, you look at doctors and nurses, a lot of them are taking it as a preventative.
So hydroxychloroquine has been around for a very long time. And before that, chloroquine for the treatment of malaria, and more recently for treatment of diseases like rheumatoid arthritis and lupus.
Trump has touted hydroxychloroquine as a potential cure for the novel coronavirus. But is it safe? We asked UPMC Dr. Michael Lynch.
It doesn't take much extra, so maybe just 1 or 2 extra pills even, to become really dangerous on its own. It can also interact with other medications that can lead to problems with, say, heart rhythm issues and things like that. That in the worst case can be deadly.
Dr. Lynch says there are studies underway to determine its effectiveness, but says right now the unknown is too great of a risk.
And so far, there hasn't been any good evidence that hydroxychloroquine has any benefit for the treatment or prevention of coronavirus infection. But there have been good studies that demonstrate that it can be harmful when being used to treat.
Would you want somebody to take it if there's no symptoms or no positive signs of coronavirus?
I would not prescribe this for anyone, certainly for prophylaxis, outside of potentially a research study. But right now, for my family members or myself or my kids, for instance, I would not prescribe this medication.
Health experts like Dr. Lynch say the best advice they can give is to consult your doctor before taking any medication. And what they don't want to see is this drug flying off the shelves, creating a shortage for those who really need it. Reporting tonight, I'm Melanie Gillespie for Channel 11 News.